Inferior alveolar nerve block provides anesthesia to the pulps of the 8 mandibular teeth in that quadrant, the buccal soft tissues and bone anterior to the mental foramen, the anterior 2/3 of the tongue and the floor of the mouth, and the lingual soft tissues and periosteum. A 25-gauge long needle is recommended. For a left inferior alveolar nerve block, the right-handed operator should sit at the 10 o'clock position facing in the same direction as the patient. For the right inferior alveolar nerve block, the right-handed operator should sit at the 8 o'clock position facing the patient. There are 3 criteria for determining the correct insertion site for the needle. The first is the height, the second is the anterior-posterior position, and the third is the depth of penetration. A finger is placed on the lingual aspect of the ramus and pulled anteriorly until the carotenoid notch is palpated. The carotenoid notch is the greatest concavity on the anterior border of the ramus. The barrel of the syringe is placed in the corner of the mouth on the opposite side. The needle tip touches the most posterior aspect of the pterygomandibular raphe. The needle tip is then moved half the distance toward the carotenoid notch and then half the distance back toward the raphe. This locates the injection site, which is 3/4 of the distance from the carotenoid notch to the raphe. The needle is then inserted and advanced slowly to the site, which is 3/4 of the distance from the carotenoid notch, and then half the distance back toward the raphe. This locates the injection site, which is 3/4 of the distance from the carotenoid notch to the raphe. The needle is then inserted and advanced slowly until bone is contacted. The average depth of penetration is between 20 and 25 millimeters, which is 2/3 to 3/4 the length of a long dental needle. Once bone is contacted, aspiration is performed twice, and if negative, 1.5 to 1.8 mL of local anesthetic is administered slowly. The buccal nerve block provides anesthesia to the soft tissue and periosteum on the buccal aspect of the mandibular molars. The injection is given immediately following the inferior alveolar nerve block. A 25-gauge long needle is recommended. The needle is withdrawn, the syringe is repositioned, and the needle reinserted in the mucobuccal fold distal to the last mandibular molar. 0.3 mL of anesthetic is administered.